Okay, we're going to start a minute early, and we're going to see if everyone can see and hear us. So I see that people are coming into the chat. So I just would like everyone to just let us know if you can see and hear us. Hello, can anyone hear and see us? Perfect. Hi. Okay, hi everyone. I see people are coming in. Okay, excellent, excellent. So everyone can hear and see us right now. We know we had some technical difficulties the last couple of sessions. These are the things that happen sometimes when you're doing a live virtual conference. So thank you so much, everyone, for your patience. And I'm happy to see that you guys can hear and see us both. So I'm going to put up the presentation because let's get the party started, right? It's how it should roll. So welcome everybody to day 3, session 3. Become a better storyteller and implement a TMF maturity process model. So happy hump day to everyone. Good morning, good afternoon, or good evening, wherever you are in the world. My name is Kimberly Bruce, and I am working in the marketing team here at Montreal. And I am so pleased to be your host for today. And I'm happy that we're able to get this party started. So without further ado, I just want to make sure that we go through some housekeeping rules. So just want to let you guys know that all sessions are being recorded and they will be made available at the end of the day. So I know that we had some glitches in the last 2 sessions, but don't worry, the recordings will be made available along with the slide deck. I know some people had some questions regarding where the slide deck and where they can see the recordings. If you just go back to the past or previous sessions, you'll be able to just rewatch those recordings there. All attendees will receive a certificate of attendance for the entire TMF week, not just for each session. So beware of that. After the conference ends, you guys will be getting a nice little treat, which will be a certificate of attendance for TMF week, so that you're able to share that on your social media platform. So this is an interactive session, so please feel free to ask questions at any time. You will see it on the side panel of your screen. There is an engagement panel that's there. So there's a question, there is a speech bubble with a question mark. Please just put in all of your questions for Donatella. This is going to be a very, very good session today. And the networking breaks, of course, this is what TMF Week is all about. It's about, you know, rubbing elbows with your colleagues and peers. So please, please, please make sure to connect in the lounge or at the Montreal booth. Okay. So now, without further ado, I'd like to present Donatella Ballerini to you. Donatella began her career in the pharmaceutical industry 12 years ago in global clinical development at KC, where she managed late-phase clinical trials on neonatology and rare disease, focusing on clinical documentation management. In 2020, she became head of the GCP Compliance and Clinical Trial Administration Unit in KC, where she ensured the compliance of all the clinical operation processes with ICH GCP, as well as to guarantee a continuous inspection readiness of the TMF. Her expertise and passion for TMF have now led her to become head of eTMF services at Montreal, and we are so, so happy and pleased to have her here. So without further ado, I'm going to pass the baton over to Donatella so you can share your screen and get the party started with your slides.
Thank you so much, Kim, for this great introduction. So just give me a few seconds. I'm going to share my screen and my slides.
Excellent.
So just give me a few seconds again.
No
and
worries.
Here we are. Kim, do you confirm that you can see the slides?
I can see the slides and they're up.
Okay,
excellent. And just one more spot check. Can everyone hear and see the presentation that is there? Just want to make sure. Can everyone say in the chat everything is okay? Okay, perfect. So we can get started.
Super, super. So let's start for checking the agenda for today's presentation. So we will start with the meaning and the definition of a process, and then we will see the elements of a process. We will move to see and discuss about the maturity level. We will discuss about the 3 dimensions of inspection readiness, and we will conclude with Montreal ETMF services. So as anticipated to you, I want to discuss with you the meaning, the definition of a process. So what is a process? Well, summertime is approaching. I think that every one of you is going on holiday, is wishing to go on holiday, and definitely what you're going to do. Well, you're going to define your destination, maybe you book the flights, you book the hotel, the accommodation, and then you prepare your bags, check the passport, check the documents, and finally, when it's time, you will take the flight and go to holiday. So that is a process. I mean, when you're preparing and organizing and planning for your holiday, this combination of steps, of activities is a process. So we can define a process as a set of activities and or task to get a specific result. When you go through the security protocol at the airport, that is a process. When you're preparing a cake or something in the kitchen, you are following a process. Even when you write a document, you are following a process. You start from a draft version, then maybe there can be different review steps, and then you finalize and approve the document. So different steps, different activity to have a process in place. And we are talking about trial master file. So I want to hear your opinion after this definition of a process. Do you think that is a trial master file a process? Yes, no, or I don't know.
So everyone, if you can go towards the poll section, it's right next to the Q&A icon where it has the speech bubbles. Speech bubble with a question mark. The poll has been activated, so you can go there and submit your answers. I see that some people are getting in their answers there. If you go to the side panel, you will see that there is a poll section, and we just activated the very first poll. Is the trial master file a process? So we're gonna wait a few, we're gonna wait a few minutes or a couple of minutes to get all the answers in. Just go to the side of the panel, the engagement panel. It is the third icon after the Q&A section. That is where the poll is being launched.
Thank you, Kim. I wait for your feedback.
Yes, perfect. So it's coming in. I'm seeing some numbers coming in right now. So this is good. This is exciting. I always love to see engagement happening. Okay, we're gonna give it a couple of more seconds.
Yeah, sure.
Come on, people, get your answers in. Let's get it done. Okay, I'm ending the poll now. And so it would seem that 96% said yes.
Oh, wow. Interesting. Interesting. Well, thank you. Thank you for sharing your opinion, for giving your answer. Well, TMF is not really a process. I mean, TMF, as you know, is the collection of the essential documents that permit the evaluation of a clinical trial. This is the definition, basically, of that we have in GCP, ICA GCP. But my favorite definition is that trial master file is the storyteller of your clinical trial. Because from the sponsor point of view, thanks to the TMF, you can give the evidence to the inspector that you were in compliance with GCP requirement, with regulatory requirement, with study plans, with SOP. And from the inspector point of view, TMF is the proof, is the way that they can use to check if the sponsor and everything was done in compliance to ensure the data integrity and the safety of the patient. So let's say TMF is not really a process, but definitely, if you want to manage TMF, you need to have a process in place. So you need to answer some very basic questions like, how do you collect all the pieces of my story? So all the documentation that will permit the evaluation of a clinical trial? How do you ensure the quality and the consistency? How do you guarantee the compliance with requirements, with GCP, with protocol, with plans? How do you guarantee the completeness? How do you ensure the inspection readiness? And how do you document the quality checks? So if you think the answer of these questions, and obviously the list can be longer, you will have a process. I mean, you answer to this question with a process for TMF management. So definitely when we talk about trial master file processes, we need to think about the TMF steps. So what are the main activities to be performed when we're talking about TMF management and when? So obviously even the timing of this activity is very important. And then who is going to perform this activity? So define the stakeholders of the steps of your process. And obviously, last but not least, what are the goals? So what do I want to achieve with these steps, with this activity? I want to ensure the completeness, I want to ensure the quality, I want to check the inspection readiness. So steps, stakeholders, and goals are, let's say, the main elements of a trial master file process. And if you want to have a look in detail to each element of the definition of a process, well, the starting point is the goals. So define the objective and the goals that you want to get, to reach using your process. And then you need to plan and to map your activities, set the action, and assign the stakeholders of each of these activities. Then test the process and implement the process in your daily business. Monitor the results, because definitely you need always to check if the process that you put in place is correct and is working, and repeat if it is working, or try to improve if you have any issue, any gaps in the process. So the very starting point when you want to implement a process, especially for TMF management, for a good TMF management, is to define the goals, the final objective. And when we talk about TMF, I think that we all agree that completeness is a goal. Obviously, if the story is not complete, the inspector will not be able to reconstruct the conduct of the trial. So you can have several findings and several issues during inspection. The quality, because the documents that are filling the TMF needs to be good documents. So you need to be in compliance with our core principle, good documentation criteria. And let's say that inspection readiness is a combination of all these principles and goals that we try to achieve through our TMF process. So inspection readiness, I would say that is the main goal when we talk about TMF management. But how do you ensure, in your experience, by your opinion, TMF inspection readiness? So by regularly monitoring your trial master file, by using metrics and KPIs, by developing a robust process, all the above, or I don't know. Want to hear your voice. So Kim, can you help me? Kim, I can't hear you anymore.
Sorry about that, everyone. Sorry, I was on mute. So if everybody can go over to the side panel, that's the engagement panel. We just launched the second poll, how to ensure TMF inspection readiness. We'd love to get your answers in. So if you could just make your way over to the engagement section. If you hover over the little icon, it will let you know that it is a poll. It will be right after the Q&A section. So that's the section where you need to go in order to get your answers in for the poll. So we're going to give this maybe, a few more seconds so that you guys can get your answers in.
So very interesting to hear your voice, to hear your experience or opinion. Because definitely, inspection readiness is one of the main topics that I think that we're all looking for when we
Absolutely.
think about trial master file.
Absolutely. Okay, I think we're going to end the poll. I think we got some results
Okay.
here. And I'm showing the results. And it looks like for question or poll number 2, how do you ensure TMF inspection readiness? 95% said all of the above.
Okay.
Yeah. So that was the
Okay.
number 1 answer.
Great. I mean, definitely yes. I mean, monitoring the status, the health status of your trimester file is very, very helpful. Use metrics and KPI to measure the main parameters for this health status of your TMS is definitely important, and have a robust process for TMF management is important as well. But my answer would be, in terms of priority, let's say, developing a robust process. Because if you develop a robust process for TMF management, the monitoring and the metrics and KPI will be part of this process, obviously. So let's say that I would put C just because the process involved in itself the monitoring and the metrics and KPI. So, okay, we have defined, let's say, our goal. So we want to be inspection ready with our trial master file. And now, what are the steps? So what are the activities that I have to perform every day to achieve this goal? I want to reach the top of the mountain. So what is the path, the best path that I have to go through? What are the tools that I have with me? For example, obviously, if you're managing a paper trial master file, maybe you will have trackers, plans, spreadsheet, this kind of stuff. But if you're managing an eTMF, so an electronic trial master file, you've got additional functionality, so additional tools that help you to be inspection ready. So once you have defined your goal, define the activities that you need to perform to achieve this goal, and define even if you have already some tools that you can use to achieve these goals. After that, who is going to do what? So very important in a process, especially when we're talking about TMF management, is to define who is going to do what. So who is going to collect the documentation? Who is going to upload, in case of an eTMF, the documentation inside the system? Who is going to do the quality review? Who is going to approve a document? So all of these questions need to be answered when you develop the process, because as you know, trial master file is a collection of documentation. There is not just one document owner. There are different document owners, the sponsor, the CRO. Internally to the sponsor, there are different departments, different functions. There is the site, there is laboratory or vendors. So lots of people, lots of actors that are going to produce documentation. So inside your process, when you have defined the process, who is going to do what? So this is why I kindly suggest you a RACI table, to implement a RACI table when you're going to identify who is responsible, who is accountable, who is consulted, and who is informed for the activities of your TMF management process. So now it's time to act. I mean, you have identified your goal, you have identified your steps, you identify the stakeholders. Now do act, implement your process, perform the activity according to the process that you have developed and identified. But don't forget to check regular your process, because maybe it can work, but definitely you can have lesson learned and improve your process. Think about the quality check. Definitely you set up a quality check process for your trial master file, but then monitor if it is working, because maybe for a specific trial, there can be a need of additional quality check, of more frequently quality check, due to lots of issue with the completeness, lots of issue with the timeliness. So even if you've got a process, don't forget to monitor it and to improve it in case you find that there is any issue, any gaps. So never forget to check it and to improve it. Because the process is a dynamic aspect of your TMF management. So even if you establish a very good process at the beginning, very probably you're going to change it due to regulatory requirement. Think about the new European clinical trial regulation that came into effect just last January. It has an impact on our processes, so you need to regular process. And something will be obsolete, some will be removed, something will be added. There can be organizational changes. So maybe a unit will be changed, will be added, will be removed. So responsibility can change. Or improvement, maybe after an audit, you realize that you didn't cover a step of the process, and so you want to improve the process and develop a better process. And this is when we talk about maturity level. So before talking about maturity level, do you know the maturity level of your TMF process? Yes or no? I don't know what is it.
So we're starting our third poll. If you guys can make your way over to the engagement panel, the poll has been activated. You guys can get your answers in right this minute. I'm seeing some answers come in. Just remember that it is the icon next to the Q&A section, which is the speech bubble and the arrow. So please get your answers in. We'd love to hear from you what, if you know what your maturity level process is, if you have a maturity level for your TMF process. So let's see these answers come in. What, Donna, I have to ask you, do you think you have an idea of what the answer might be? What will be the first answer?
Oh, well, I suppose no, but
okay.
I would be very happy if the answer is yes, definitely.
Okay,
I would be
perfect.
very happy.
Okay, so we are going to give it a couple more seconds, and we're ending the poll and showing the results. So it would seem that yes and I don't know are kind of tied. Well, yes is at 35% and I don't know is at 43%.
Okay.
And then we have, yeah, and then we have no at 21%. So
okay, so a mix, let's say a mix of answers. So okay, great. So maturity level, to have the idea of the maturity level of your trial master file process, that means that you have to perform an evaluation and an assessment of your TMF process in order to identify any gaps, any priority, and the future state that you want for your TMF process. So in terms of gaps, if you remember, I show you the fact that it's very important when you're developing a process to map the steps of the process. And when you map the step of the process, you can easily understand if something is not covered by the actual process. So you can easily understand if maybe there's a repetition in an activity, if a step is missing, so you need to implement a further step between another or at the end of the process. So definitely, when you're doing a maturity level assessment, you're going to identify if your process is going to cover all the activities, all the steps necessary to ensure the compliance with requirement, with GCP, with best practice and requirements, or if anything is missing. And then think about the priority. Well, when you're going to develop a robust TMF process, definitely you need to take into consideration the different phases of the clinical trial, so the startup, the conduct, and the closure, because based on these different steps, these different phases of the clinical trial, you're going to have a list of different activities in terms of TMF management. But, you know, it's a big process, lots of activities. So maybe you are in a moment of your business that you want to focus on giving priority to the startup activities, because maybe you've got lots of clinical trials that are going to start and no one of them is going to end. So you want to focus your improvement, your assessment on the startup or on the conduct. So depends where you are in the moment that you are going to do the assessment, because you've got limited resources, limited time. So definitely you need to apply a risk-based approach and define the priority to improve your process. And don't forget to think about the final vision. So if you are going to develop a process, definitely you have to have in your mind the final vision of this process. taking into consideration the best practice, the industry benchmark, and the final goal that you want to reach, more or less inspection readiness. So definitely even the final vision, so the state as you want to have your TMF management process needs to be included in the development and the assessment of your TMF maturity model. And in addition to the process, which we have identified and I think understood that it's very, very fundamental for a good TMF management, what are, in your opinion or by your experience, the other dimensions that are fundamental for TMF management? So people and technology, people and business, technology and study design, technology and regulations. I don't know.
Okay. So we're going to be activating our last poll. If you go to the side of the engagement panel, you'll be able to see that it is now live. So you guys can submit your answers in. We'd love to hear from you. So please get your answers in here. So what are the other dimensions in addition to the process that are fundamental for TMF management? Love to get your answers. There are 5 in there. We want to know where you fall, where you land on this question.
Yeah.
So come on. Let's get over here. I see the answers are coming in.
Okay.
Okay. Like I said, I'm loving seeing that people are engaged and wanting to share their answers. So we're going to give it a few more seconds. Yeah, it's very good. So we're going to give it a few more seconds. So coming in here, a few more seconds. Oh, I just love seeing these numbers go. This is great. Okay, and we're going to end the poll now. So it would seem that the clear winner was people and technology.
Ooh,
yeah. At 55%. At 55%.
Great answer. Great answer. I mean, all the other answers can be correct, are important, definitely, but people and technology was the most correct one. So, and I'm going to explain why. So, when we talk about TMF process, definitely people, technology, and the systems, people, technology, and process are strictly linked together to ensure the TMF management, to ensure that your TMF is inspection ready. Technology will be your supportive tool for the process and people, but you need people to manage the TMF, and you need process for managing the TMF. So definitely these 3 elements combined together are key elements for your success for your TMF management. And if you want to be inspection ready, these 3 dimensions, so working together, people, processes, and technology, if they're working together, align for the same goal, which is inspection readiness, you will have the key for success. Because definitely think about a quality check, a very basic, simple quality check. Obviously, you need to have people, and people need to know what they have to check, what does it mean a quality check, or what is the difference with a TMF quality control. So people need to be trained and to have the knowledge for doing the quality check. And then you need a process in place for performing the quality check, because when the inspector will come, he will ask, can you show me the process of ensuring oversight, ensuring quality checks on your TMF? And definitely, you've got the technology that can be a very supportive tool to ensure the compliance with the requirements, to make your process more smooth, and to help people to work better. So these 3 elements combined together, if you focus your attention to all these 3 elements while you are developing the process, you will get inspection readiness. And this is the basic idea why we develop monitoring ETMF services. So we know that that we provide already an ETMF Connect, but the other pieces, let's say, of this very important relationship, people and process, were not covered. So we have identified that if we want to support people with a good TMF management, if we want to support people to be inspection readiness, definitely we need to give them even ETMF services. That means that we're going to focus not on the technology, because that is already, let's say, covered, but on people and processes. In this way, we are going to have the perfect match, the perfect combination. So we are going to provide the system, the technology, combined with the services that allow the technology to work. Because think about if you buy a great car, I don't know, a very fast car like a Ferrari. Okay, you've got a great car, fantastic car, but if you don't have the right people to that know how to use it, how to drive it, and they don't know the process of how the machine, the car is working, you will not be the first driver, you will not be a champion. I mean, you need something more than just having the tool itself. So definitely ETMF, so the system needs to be combined with the development of a process and the development of a knowledge and a good culture of TMF. And this is why we think that combine ETMF with ETMF services, this is the key to ensure the inspection readiness of your TMF. In terms of people, obviously, training is fundamental, because you can't say to a person, okay, perform a risk-based quality check on TMF. I mean, what does it mean? People need to be trained on some very important topic related to TMF. There are regulations, there are expectations from inspector, there are guidelines, there are several aspects to be considered when you're managing TMF, and so training is really important, not only for people that are, let's say, performing daily activity on the trial master file, like indexing, quality checks, uploading of documentation, but even for other units or department that maybe just need, let's say, to be aware of the requirement of TMF. Maybe they are not going to perform activity directly for the TMF management, but considering that they are going to produce documentation, it's important for them to have the knowledge of some basic regulation and requirements, to know the fundamental of TMF, to know why TMF is the basis of an inspection. So based, let's say, on your starting level, we have defined 3 different levels of training package: maturity essential, maturity intermediate, advanced maturity. Because obviously, if you have just moved from a paper management to an ETMF, I can't talk with you about risk-based approach of quality by design. So very complicated, let's say, topics. We need to start from the basis. So from the principle, the requirement, the quality check, and then it's like a sort of journey. So we start from the basis, and time after time, your experience will grow. And so you can face a different and more complicated topics like metrics, KPI. So it's really a journey with you. And what we want to achieve is a more knowledge and culture of TMF inside your organization. And this is why we have developed a different training package based on your need, but basically on your starting experience. So as already said, TMF principle and GCP, document quality control, index and reference model. Lots of people still don't understand what is an TMF index or a roadmap, TMF plan. So different topics, different training section based on your experience, plus workshop, because we definitely think that theory is important. I mean, you can't perform a quality check, a quality control if you don't know a core principle, good documentation practice. So theory is important. But if we combine the theory with practical workshop, what we can really show you what to do in daily life, think about the risk-based approach. A risk-based approach is one of my favorite topics. The theory is so much interesting. The training is very interesting. But when it comes to reality, when it comes, okay, now, how can I apply a risk-based approach? This is why we thought that we have to develop a workshop as well to do with you, let's say, and to support you during the job itself, to show you step by step and to be there with you how to perform, for example, a quality control on a TMF or a document check on your TMF. So training plus workshop, plus lots of templates and forms. We have developed some templates and forms that can be used as standard, or they can be customized by you with some support by us, but definitely that can be a very important starting point when you develop a process, because definitely you need to have an SOP or a working instruction for TMF management quality check. So we have developed some, let's say, standard SOP template, some standard working instruction template that can be very helpful to start to develop and design your process. And obviously, it's not just about training. I mean, with training, we are going to cover the need of having people knowing what TMF is, know what to do, so to have the knowledge and expertise for TMF management. And then the other element for success is the process. So what we're going to do with you is to understand your maturity level, define the vision that you have for TMF process, and redesign with you your process. Because definitely when you're managing an eTMF, it's not just a matter of buying a software, it's a matter of implementing a new process for your trial master file management. So we can be there with you and define where you're starting and where you can, let's say, arrive after an assessment and a development of a process. But this is not the last things. I mean, we can develop with you your new process for TMF management. So we can do the assessment, checking what is your maturity level, what are the gaps, what is missing, so what can be implementing in your process to be in compliance with the regulation, with requirement, with guidelines. But we can even support you doing some health checks on your TMF, because definitely health checks and oversight are two very important tools that you have to ensure inspection readiness. So if you don't have the expertise, or if you want someone who help you to improve the process for checking health check and oversight, we can be there with you. We can be there, make you aware of the status of your TMF at every time, at every stage of your clinical trial. And definitely, oversight is a sponsor responsibility, as we know, and so we can definitely guide you and teach you how to perform oversight, but we can even do the oversight for you. And all that to ensure the quality and inspection readiness of your trial master file. So I think that you have understood, but if you are managing TMF, you know by experience that TMF process can be really, really a challenging journey. But please don't be afraid. You are not alone. Montrium's eTMF services can be your guide, can be your expertise guide, and can make your knowledge in terms of TMF improved and better. So this was my last slide. And now
Excellent. I'm going to remove you.
I stop to share.
Perfect. Thank you so much for that presentation. It was very, very insightful. And I'm loving the comments that are coming into the chat, especially when it comes to laying that foundation, creating that process. So laying a foundation first, so that, like, because we're so quick to get to, Rob had mentioned this, so quick to get to metrics and gadgets and data, and we forget about that foundation. And people are saying, like, yeah, you need to like walk before you run, and you need to, like, you know, crawl, walk, run to get it right. And it's 100% true. And it's a mindset really to understand why we put these things in place, these processes in place to help us do the work properly, right? So now that we are done with the wonderful presentation, Donna, thank you very much. Hats off to you. We're gonna move on to the Q&A section. So we got a question from Rob saying, how do you manage regular changes in processes and process within a regulated environment where SOPs and procedures can often be very restrictive?
So my answer would be, attend our training on TMF regulation because that is part, let's say, of our training. But anyway, so definitely you need to keep attention and to be very updated in terms of regulation when you are talking about TMF management, because definitely they got a very big impact. And so again, it's a matter of implementing a process to ensure that your TMF management is updated and in compliance with the requirement. So check the requirements, check your process, and monitor your process, because definitely a requirement can change, can be different from country to country. So define, let's say, your area, your focus area. So definitely the best rule, the best suggestion that I can tell you is you need to have a process in place inside your organization to manage the regulatory requirement changement and to be sure that your TMF is always in compliance with this new requirement, with these new changes. It's a big effort because even if the changes are not luckily very frequently during a year, they come. And so whenever you are aware, you need to prepare yourself. I mean, now that the new clinical trial regulation is effective, you can't start now to be updated with the new regulation. You have to start it at least last year to be now ready that the regulation is effective. So it's really a process to be implementing, to plan, and to be prepared when the regulation or the guideline will be effective.
Excellent answer. And I just wanted to, I'm just loving the engagement in the chat. I just love that Anna Nowak said everyone should hear your presentation. So I think that that's pretty awesome. So I love that so much. Next question is, what would be your main advice to convince TMF contributors to be TMF oriented and to consider TMF activities like filing, quality check at the same time level than other activities?
This is a very good question. I mean, I faced this issue, problem, situation many times in my previous experience in sponsor side and clinical development. It's training, based on the roles, training based on the goals that you want to reach with the message of your training. Give you a very few example. If someone is going to perform activity inside the eTMF, definitely has to receive a different training from people that maybe just need to be aware of the importance of TMF, or the requirement of TMF. So based on the goal of the message that you want to send to the audience, to your employee, to your colleagues, define the topic of the training. Because by my experience, very often they don't care. Some units, some departments, some people don't care about TMF just because they are not aware of regulatory requirements, the finding and the bad consequences in case of finding TMF finding after inspection. So it's not that they don't care, but they don't know. And so training is the starting point. And then involvement with workshop, with session to make them more aware about, again, the consequences, the implication that you will have if your TMF is not inspection ready at any time. So really, when you, I remember that when I performed this kind of training to someone that were not so, let's say, aware of Trial Master 5, they remain shocked. They remain shocked about the GCP findings related to Trial Master 5. I mean, the majority of the findings that I showed them looked to MHRA record of GCP finding were related to Trial Master 5. So the thing that you, let's say, consider, that you don't consider during a clinical trial because you're very focused on timeline, enrollment, milestone, and blah, blah, blah. It was the first one in terms of finding. And, you know, effort for remediation, resourcing, time for remediation, kappa plans. So very, very big effort. So definitely you need to make people aware. And this is why I think that training as a starting point is really, really important.
Okay. That's very good points. I want to thank you so much, Donatella. This was such a great presentation. It gives you a lot of like food for thought on how to think about what you want like long term and what you need to put in place in order to get there. So thank you so much. I wish we could answer all of your questions, but we're at time right now. We need to move on to the next session, which will be streamlining author productivity with workflows. So this is going to be a product showcase. It's going to be our last product showcase. So please feel free to go and join this session. We very much recommend so that you can see what TMF can do when it comes to workflows. So again, thank you, Donna, for that wonderful presentation. We hope to see you again. We definitely will see you again the next TMF, so that you can get some insights here. And just so that everyone is aware, after the product showcase session, make sure to network at the lounge and at the Montreal booth. But one other thing that I wanted to let you know when we leave this session, there is a survey that we would love you to answer. And this is going to be for the TMF Fireside panel that is taking place on Thursday. We want to get your questions in because this is where you ask the experts anything revolving TMF. So once again, want to say thank you, Donna, for a wonderful presentation. Thank you all for, thank you so much. And thank you all for joining the session and for your patience and for our technical difficulties. And I also would like to let you know that you will be able to see all presentations on demand. When you go back into the platform, you just can click on rewatch session. So have a great day, everyone, and see you in the next session. Bye.
Bye, everyone. Thank you. Bye.